Dr. Robyn Macsata is a vascular surgeon. She operates on blood vessels that have been blocked and no longer allow blood to flow through them. A major cause of blockage is the buildup of plaque. This is a fatty substance that can accumulate over the years on the inside walls of our arteries.
The most common reason people have strokes is their carotid artery, which is the main blood vessel that gives you the blood supply to your brain. With time, plaque starts building up in that artery. And as the blood flows through, pieces of that plaque can break off and go to the brain, and that's what causes a stroke. So you can go from being completely normal to all of a sudden having symptoms. So usually it's an acute thing that happens with no real, anything that's really leading up to it.
When a person has a stroke, one side of their face may start drooping, or they may have other symptoms.
When somebody's having a stroke, usually what happens is that one side of their body doesn't work, so they can't pick up their coffee cup. They may notice that. They can't speak. They can't get their words out properly. So usually it's something focal that occurs, and you can have a small stroke called a TIA, which is a transient ischemic attack that usually lasts about 15-20 minutes, or you can have a full stroke that lasts and you may or may not have recovery from it.
There are 4 risk factors that lead to a buildup of plaque and the resulting danger of stroke.
And that's high blood pressure, high cholesterol, diabetes, and smoking. So the first thing that people should know is to try to control these risk factors.
A doctor can help you control high blood pressure, high cholesterol, and diabetes by prescribing medicines, as well as a more healthy diet and exercise.
Smoking is a very big one that everybody should quit smoking to try to prevent stroke and also a heart attack.
Strokes are the 4th leading cause of death in the United States, but the 2nd cause globally.
In the United States, it is a very high issue where people can end up either dying from a stroke, but even more importantly, they can end up in a nursing home. So they cost a lot in healthcare dollars because it causes chronic nursing care. In developing countries, now that these risk factors are getting higher with the change of diets in developing countries, now this is becoming an issue, a global issue, even in the developing countries.
If someone has symptoms of a stroke, getting them to medical care quickly is crucial.
Rapid medical care is very important. If this does happen, patients should get to the emergency room immediately because they can be treated with something called TPA, which is basically a lytic therapy. It's kind of like it's like a clot buster, so it'll bust the clot up. So if you get to the emergency room within 4 to 6 hours of having a stroke, the emergency room doctor can infuse this clot buster into your veins, and basically that'll hopefully break up the clot and cause the stroke to go away.
But surgery is often needed to permanently unblock an artery.
Surgery is called a carotid endarterectomy, and that's been done since about the 1950s. The way it's done is a patient goes into the operating room, they get general anesthesia. We make an incision in the neck that goes from about here to here, cut down on that artery, clamp the top and the bottom of the artery off where it looks good, open the artery up, and then basically clean that plaque out of there completely. Then most of the time we close it up with a patch to keep the artery open long term. Usually patients stay in the hospital about a day after that surgery is done, and they usually do very well and go home the next day.
There is also a newer technique that involves inserting a balloon to force open a blocked artery and then a stent to hold it open. But this procedure has higher risks.
And I think this is probably the most important thing of anybody watching to learn from this interview is really what can you do to prevent your risk of stroke. And it's not just stroke, it's coronary artery disease too. So anything you do to try to prevent a stroke, you're also going to prevent, dying from a heart attack. So there's new medications out there, to treat diabetes, hypertension, and hypercholesterolism. But what can you really do for yourself? And that's really try to live a healthy lifestyle. So if you need to lose weight, lose some weight. You need to exercise and go to the gym, maybe 3 to 5 days a week. Try to exercise a half an hour a day. That's been proven to decrease the risk of diabetes, high blood pressure, and high cholesterol. And probably the most important thing out there is if people smoke, they need to quit smoking.
Strokes are a major killer around the world, but doctors say the majority of strokes are preventable. Strokes are a major cause of illness and death. The good news is that the risk of stroke can be substantially reduced by quitting smoking and by keeping fit. If you suspect that someone has suffered a stroke, it is imperative that you get them to urgent medical treatment. For Saudi Good Morning, this is Burton Bolag in Washington.